active feels great until it doesn't, sometimes due to injury or even just age. And that can be really hard mentally. Many of us just don't want to be slowed down in our daily lives and activities. Dr. Christopher Dillingham is an orthopedic surgeon with Sarasota, Dillingham and Stewart Orthopedics, and he joins us to talk more about the mental health aspect of orthopedics. What a great topic. It's great to see you.
Yeah, thanks for having me today.
How do these two issues become interrelated?
Well, it's interesting because during my training, I never really heard anything about mental health aspects. And it wasn't until I got to town and started treating people and following them that I would talk to them. And a lot of times I'd see them just blankly staring off. And I know that they're not interested in the biomechanics I'm trying to explain and how excited I am. So I kind of learned to just sit back and say, hey, like, what are you thinking right now? And it was never about the injury. It was about, how am I going to get my groceries? I normally use a cane to walk. How am I going to do that? How am I going to comb my hair? Like simple things that they're blowing to, they just assume I know how to do the shoulder the correct way. They're past that. They want to know, I play pickleball every Saturday. When am I going to do that again? That's like my social outlet. You know, just the simple things in life. It's much bigger.
Yeah. Honestly, as a physician, it's incredible to hear you say this because I know you're extremely proud and competent of all the biology things that you can fix. But yes, for those of us living life, we just want to know that it's going to be okay. So let's separate orthopedics into kind of two categories. We'll do senior citizens and athletes. So let's start with senior citizens because that is the bulk of our population here, and I'm sure a lot of who you see. What's their biggest fear when it comes to orthopedic injury?
Independence is key. And I think we all understand that. But if you can't drive, your whole life is so much more scary. You have to depend on everybody for the simplest of things. So losing independence with an injury, with a joint replacement, down for a while, I think injuries can be even scarier because you probably weren't planning on them. A lot of people know their shoulder's been bad for a while. At some point I'm going to deal with this, and they kind of are processing it. If you fall off your roof hanging your Christmas lights and it's almost the happiest time of the year, and all of a sudden, you know, your life is thrown upside down, you're more depressed, you're more scared, all those things start to happen to you.
So how do you deal with that? Do you recommend counseling? Do you try to counsel?
Yeah, I mean, I think number one is just being aware of it. So for me, all through training, it's all biomechanics. I never was aware of the issue. So now bringing it up to him, just letting him know, hey, this is all right. We're going to get through this. Talk to your family, talk to your friends. We've started prehab appointments where they come back, see our therapist. Our therapists go through things, put them in a sling. A lot of people don't even think about, I'm going to be in a sling, can't move my arm. Show them how to eat left-handed. Give them devices, little things, tips. And then it also gives them a time to go home, take a day or two and think about things, and then come back. Unfortunately, when I see them in the office the first time, a lot of things are just like overwhelming and blowing right over their head. So if they have a day to like go home, come back, see me for a pre-op appointment, see me for a prehab, and then I'll just tell them, hey, write down anything you want to talk about, and it doesn't have to be related to how big the incision's going to be, all of those questions. It can be, you know,
how am I going to do this?
How am I going to do this? Yeah, all of those things.
Very valid concerns and something we often don't think about until it happens. You know, okay, so let's move to athletes then. A little bit of a different scenario. For many, it might be their livelihood, their future, their hopes and dreams. It's got to be crushing. You must have to approach that carefully.
So the athlete's mindset is completely different. Their whole life and structure is not only about like moving forward, either getting into college, getting into professionals, or even just the recreational athlete. I'm a big runner. If I can't run an hour a day and decompress all of my things, my thoughts, like my life is just upside down. So the athlete has all of those same fears and the fear of, if it's a bad injury, is this going to happen again? Am I ever going to be normal again? Am I going to be as good as I was? And then, you know, so there is multiple layers that go into that for sure.
It is really important, I think, as a physician to recognize this in your patients and give them a place to feel free to discuss.
Sure. I think being open with them and honest and just let them know that, hey, you're not the first athlete that's dealt with this. This is normal to have fear. I just took care of a tennis player who's going to leave for college, and, you know, is he going to redshirt now? Are they going to pull my scholarship? Am I not going to be good? And, you know, you're like, calm down.
Right.
Most coaches are understanding. They've dealt with injuries. Let's focus on getting you better mentally, physically, and everything so you can get back to doing what you love.
All right. Well, thank you for bringing this up, whether it's a senior citizen dealing with an aging injury or an athlete dealing with a performance injury. We certainly know we have great orthopedic surgeons to solve the problems, but it's also important to recognize the mental health impact. To get more information about any of your orthopedic concerns, you can find the team at sforzodillingham.com.